I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina, and I have no financial conflicts of interest. I'd like to talk to you today about Diagnosing ScamPharma, Part 5A, the new white paper biopsy. For orientation, I really recommend that you watch Diagnosing ScamPharma, Part 4B, which introduces you to the original white paper. This series of ScamPharma videos is about Regenerize ophthalmic solution. First, a brief review of the difference between real pharma, real over-the-counter products, and ScamPharma / over-the-counter pretenders. First of all, is there FDA approval? Real pharma, yes. Real OTC, no. And that's because the FDA does not review or approve over-the-counter products, but they do have rules about them. In particular, they have rules about what can and cannot be an over-the-counter product in the first place. ScamPharma OTC pretenders, no FDA approval, and they're breaking the OTC rules. What can these drugs be legally marketed for? Real pharma can be marketed for on-label diseases. Real OTC for specific symptoms. The others, nothing. What about labeling and consumer information? Prescription drugs, which is to say real pharma, have a package insert, which is this incredibly thin piece of paper which has been folded up worse than a map and contains tons of writing in tiny font. The font size that equals "Don't read me." But you know what? It's there. Real OTC has box and bottle labeling, and the FDA controls OTC product packaging, which must easily allow the consumer to decide if the product is an appropriate choice to treat their symptoms. ScamPharma's packaging, whether it's an insert or the box itself, is minimal and misleading. Are the exact ingredients known? Real pharma, yes. Real OTC, yes. ScamPharma, no. And they won't tell you if you ask. They'll say it's proprietary. Are pharmacies involved? Prescription drugs, yes. Prescription drugs must be dispensed by a pharmacy. Real OTC, no. You buy it there, but the pharmacist does not dispense it to you. And ScamPharma, no. Typically their products are sold direct from the manufacturer or possibly through resellers, such as dry eye treatment websites. What requires a prescription? Real pharma always requires a prescription. Real over-the-counter never requires a prescription. That's why it's over-the-counter. ScamPharma can't quite make up its mind. It might start out as prescription only with fake prescribing, but when that becomes logistically inconvenient, suddenly the product is now over-the-counter, just like what your doctor used to prescribe you and sell you. But now you can buy it directly from us, the ScamPharma company. How else can you tell the difference between real pharma and ScamPharma? With real pharma, you know precisely what's in the bottle. The FDA knows how it's manufactured. Everyone knows how it works, what diseases it has been proven to treat, what the adverse events are and how often they occur. There were actual clinical trials on humans, which are very expensive. The drug sponsor respectfully fears the FDA. The prescription drug, if it is prescription, is FDA approved. And the topic of our conversation today, there are real medical references describing the utility and safety of this product. ScamPharma, none of the above. Typically advertised as having potential or possible benefits, look for the word may. May, might, in some cases. Those are clues. The manufacturer evades and misquotes the FDA. Typically, the evidence is testimonials from patients and doctors. And there are fake medical references. Let's start talking about that fake medical reference. First, I have to explain to you what a white paper is. Investopedia tells us that a white paper is an informational document issued by a company or not-for-profit organization to promote or highlight the features of a solution, product, or service that it offers or plans to offer. What's a medical white paper good for? It's good for marketing without real data. It's good for disguising paid opinion as thoughtful analysis, and also baffling with bullshit. And the big bullshit baffler was this iWorld white paper published a couple years ago on the therapeutic potential of Regenerize ophthalmic solution in the treatment of dry eye disease. I've read it, all of it. Then I had to lay down for a while. more prescription bed rest. Unsurprisingly, the entire issue of Eye World for that month was supported by Regenerize. What's a medical white paper not good for? It's not good for publishing original clinical or laboratory research or increasing the scientific reputation of the authors. In fact, reputable peer-reviewed medical journals do not publish white papers about drugs. These are 3 journals that I read, and very occasionally there will be a white paper about social policy, manpower needs, or similar topics. You're not going to find a white paper that calls itself a white paper talking about the wonders of a particular commercially available product. If you search white paper ophthalmology, you get some very embarrassing hits. This popped up right at the top. You see the $20 bills and the golden egg. This white paper is about the golden goose, how to determine and increase the value of your practice. And another one, white paper, private equity investment in ophthalmology, 2020 outlook. Ugh, bankers. So Snail wants to confirm, white papers are not real medical references. Right. Glad you're paying attention. Regenerize Instagram account popped this ad up not that long ago. And the Dry Eye Foundation's guess was that it said peer-reviewed something white paper. But they already had a white paper. This is a new white paper. This is kind of an exciting announcement, even for us. What are they going to say? Okay, the white paper went live. And the first thing you had to do to read it was to provide contact information. And look at the tiny print at the bottom. It says, please note that you can opt out of any Regenerize emails at any time. I wasn't sure if maybe they had me blocked in their database, but I thought I'd give it a try. Look at that. I'm not blocked. I can read the article. Exciting. Okay. Sit down, get the snacks and the drinks, get ready, go. Regenerize Ophthalmic Solution, a new therapeutic agent to relieve dryness of the eye for tear hyperosmolarity-induced pathologic changes in the eyes of patients suffering from dry eye discomfort. So Snail observes, we're calling it dry eye discomfort, not dry eye disease. And I'm like, yeah, that's because they're still trying to evade the Food and Drug Administration. Now let's talk about how to spot a fake medical reference, revised and updated for 2023. Slide 1. If the author of the reference owns the drug manufacturing company, it's probably fake. If you have to sign up for ads to access the article is classified as a white paper, one or more small clinical trials are cited as evidence, and those clinical trials are not published separately, those are all definitely diagnostic signs of a fake medical reference. So there is a clinical study that's referenced in this white paper. I have to take back the word referenced. It's discussed in the white paper. It's a study of 131 dry eye patients. And we get some information in a couple of different paragraphs about what happened to those individuals when they used Regenerize. Of course, Snail has seen the placebo effect part 2, so he knows to ask, was this study double-blind? Was it placebo-controlled? To which I say, get real. And most specifically, this little clinical study, about which we know essentially nothing except that all the patients appeared to have wonderful results, this is the list of references for the white paper, and there's no separate reference discussing this study in detail. What about the journal? I had never heard of the Austin Journal of Clinical Ophthalmology. But the journal was happy to tell me that it had an impact factor of 2.8. The impact factor gives you some idea of how influential the journal is. And the most common way this is counted up is by how many times articles that are published in the journal are cited by other authors, either in the same journal or a different journal. So an impact factor of 2.8 is not that great, and I don't think I'd be putting that right out there on the front. I thought I'd ask PubMed what they knew about the Austin Journal of Clinical Ophthalmology. So it turns out that, as far as PubMed is concerned, Only 2 articles have ever been published in this journal. Well, there are more articles than that, as we will see shortly. But what this means is that the Austin Journal of Clinical Ophthalmology is not actually referenced in PubMed. And since PubMed is about the only way that people find your articles to therefore include them in their own work, journals are fairly desperate to get onto PubMed. So either they didn't try hard or they did try hard, but it never worked. This is not a strong start. I thought I'd look into that impact factor a little bit more. I'm a trust but verify kind of person. And just like checking your credit score, there's a couple of different places where you can look up a journal's impact factor. I searched by the ISSN because that's very specific to the journal. And as you can see on the right, no results. This particular impact factor rating webpage had never heard of the journal. I thought I'd try a different website. And this time I searched by name, Austin Journal of Clinical Ophthalmology, and once again, no search results were found. So nobody really knows about this journal anywhere. I then went to the journal's own homepage, and I counted up how many articles were available. There were 113 PDF files of articles. I thought I'd check on the editorial board, see if I recognized any names. And I found that there were 136 people on the editorial board. I mean, that's like a crazy ratio. I've never seen that. Being on an editorial board of a major journal is a huge amount of work. Nobody really wants to do it, and they sure don't want to do it for a long period of time. So that made me laugh right there. But then I took a look at some of those PDF files of articles. The first 10 listed articles contain 4 research publications and 6 editorials. And now I knew everything I needed to know to form an opinion of the scientific credibility of the Austin Journal of Clinical Ophthalmology. And that's my opinion. I collapsed laughing. Okay, I picked myself up off the floor and made the next slide. How to spot a fake medical reference, slide 2. The article is in a pay-to-publish journal. It's online only, and it's open access, which means free to readers. And somebody at the journal was happy to tell me that they would publish my article for $420. That's actually pretty cheap. And I want to mention now that not all pay-to-publish journals are schlock. There are many more legitimate, high-quality medical research manuscripts being generated these days than the big, established print journals can possibly publish. So don't assume that because it's online, open access, and pay to publish, that nothing that is published in that particular journal is of any value whatsoever. Do a little bit more investigation, though, and you'll find, as with the Austin Publishing Group, that maybe you really shouldn't believe those articles too much. Okay, how to spot a fake medical reference, slide 3. When the reference is published, and then there is an immediate flurry, or perhaps let's say blizzard, of public relations activity. So Regenerise started to announce everywhere it could announce this new peer-reviewed scientific white paper. It appeared in Newswire, Yahoo, Live 5 News, something called PatSnap, Investors Observer. Okay, I have to admit, back when I was actively publishing in academia, I never went to the press to announce that I had published something. It's just kind of not what you do when you're a medical scientist, unless you're publishing the true invention of cold fusion, in which case, yep, publish cold fusion, make an announcement, get taken into protective custody by the feds. But this is just ridiculous. And I have to ask, the Yahoo announcements, were those good timing or bad timing? Because 5 days before the Regenerise announcement, Yahoo was telling us all, don't use amniotic fluid eye drops. And for those of you who are protesting and saying, but Regenerize, it's not amniotic fluid eye drops, it's placental-derived biomaterials. I've got two pieces of information for you. First, in that public safety notification, the FDA specifically mentioned Regenerize. They cited it as one of the manufacturers that received an untitled letter. Second, in fact, we have lots of information from different sources, which pretty much tells us that Regenerize contains amniotic fluid, not ground up filtered placenta. But we can't share that with you right now. Well, what was wrong with the original white paper? Why did there have to be this new white paper to actually give Regenerize another promotional boost and to maybe draw attention away from that original white paper? And by the way, if you biopsy the original white paper, it too is a fake medical reference. But there were a couple of big problems. First of all, there were pages of talk about biologically active proteins. And second, the final paragraph painted a huge target for the FDA to aim at. Specifically, the last sentence. Due to its potent immunosuppressive and regenerative properties, Regenerize should be considered as a powerful new therapeutic option in the management of dry eye disease. So you really cannot describe your product as a potent immunosuppressive with regenerative properties and then sell it as an over-the-counter product, whether or not patients realize it's being sold as an over-the-counter product. And if you don't believe me, there's the link. Be smart. Don't believe fake medical references. And I do look forward to reading my copy of the Best of the Journal of Irreproducible Results, which I just bought on Amazon. Thank you for listening.